Welcome back for our final session. I really hate it when I get to the final session because we have so much fun and so much information to provide to all of you. One thing that Sandy and I discussed as soon as the last session ended was we were talking about spouses, and the Vet Trans bus is for veterans. Now, she did say that spouses can ride with the veteran if the veteran needed that. But if the veteran has passed away or is no longer in the picture, the spouse, what's the situation?
They cannot ride without their spouse, unfortunately, and it really is a shame, but it's just not allowed. But they have just as much right as their spouse.
But the Vet Trans bus is for veterans.
Yes.
And veteran needs. And unfortunately, if the veteran is no longer there, the spouse no longer has access to Vet Trans. Okay. We said it. We needed to clarify that for any spouses out there. We're sorry to say that, but that's the guidelines. Those are the rules, and that's what we have to follow. Otherwise, we lose the contract and everything else, and we don't want to do that. So, but let's talk about Medicare. I know some of you out there on Medicare, and you have information, you have questions, and you don't know exactly where to go. Call Sandy, and we have a different number for that.
Yes, it's 619-244-5601.
Want to say that one more time?
619-244-5601.
Okay, it's on your screen. So if you have any questions about Medicare and you want to talk to Sandy about it, call that number. I want to say, too, and I hadn't talked to Sandy about this, but there are several people that had Medicare questions. I referred them to Sandy, and then I get questions or comments back. This woman is so wonderful. She's wonderful. She went out of her way to do this or that, but that's Sandy. That's the Sandy that we know. And we're, again, as I said earlier, we're just so proud of her. But let's talk about Medicare. What is it that you do for the people in our community? Well,
with Medicare, of course, people who are disabled or 65 or over who are on Medicare, many of us are. There's a lot of pros and cons with it, of course, but it's something that it's our insurance. We have the Part A and the Part B.
Okay.
The Medicare, of course, covers our doctors and our hospitals. And the programs that are there, several are income-based for the extra help to pay for that Part B. That Part B premium that comes out of our Social Security check each month can be a little much. But like I said, it's income-based to get extra help through the state of Nevada. Also, if you're just coming on to Medicare, just turning 65, of course, and you're not collecting Social Security, you need to sign up for it. If you are collecting Social Security, you're automatically enrolled. Oh. But you have to get on to it. You have a choice of staying on original Medicare, which allows you to go to any doctor you wish, but you need to purchase a Part D, the prescription drug plan, with that original Medicare. If you choose a provider like Humana or Senior Dimensions that we have here in Nye County, that's all inclusive. But you need to sign up for either original or a provider with Humana or Senior Dimensions. That $134 that they're charging us right now out of our Social Security each month is a mandate. It's something we can't get out of, unfortunately. But like I said, there is extra help, and it's income-based. Also, starting this last April, we're all getting new Medicare cards. They're not going to have our Social Security number on them anymore. It's all going to be a random number. So everyone needs to watch in the mail, and it's coming through Health and Human Services, not Social Security, and they'll be giving us a new Medicare card. Please do not throw it away. That is your new Medicare card from now on. Because of all the fraud going on, we have to have, this is what they've resorted to, taking away our Social Security number, which is a good thing, and giving us a different number. So please watch for that in the mail between now and next April in 2019. Everyone should have them by next year.
What do you do with your old one when you get it?
I would put it in a safe, maybe put a note on it that this is the old one, but you can't use both of them. And what you'll have to do is when you see your doctor, hand them that new card.
Okay.
And so they have that on file.
Now, you just gave a lot of information. A lot of information, and I hope a lot of you caught that. I have questions about it because I don't know that much about Medicare. Maybe I don't use Medicare.
Well, if you're a retired military person, you probably do have it, but you probably rely more on your veteran insurance.
Okay.
So, or you're not of age yet.
Sandy, I'm older than you are. But that's neither here nor there. Okay. For everybody that's not retired military and still have to rely on this, you gave a lot of information. I just hope that they were able to get all of that.
It is a lot. I agree with you. You're right. And it can be confusing, and I understand it completely. It's just that our government has set up this program years ago that this is our insurance. If you do not sign up for Medicare when you're 65, or if you're disabled and get a Medicare card, you are penalized. Say you turn 65 and 3 years down the line you go, oh my gosh, I don't have any insurance. They will penalize you 3 years.
Wow.
1% per year times 3. And that amount is added to the monthly premium for a Part B.
So for those members that are turning 65, they need to know this.
Yes, yes, and a lot of people don't. First of all, they're either covered by their current or previous employer, which is wonderful. If they are not, and then all of a sudden they retire and they don't have any insurance anymore, and they don't realize they don't, and they don't realize they have to get Medicare, and they have a catastrophic event where they have to go in the hospital, which costs thousands of dollars, and they have no insurance. That's out of your pocket, if you have it. So the Medicare covers a lot of that.
What's the cost of signing up for Medicare?
Nothing.
So why wouldn't somebody, when they turn 65, sign up for it?
Because they're not aware of it. That's just mainly, it's just they're not aware. I get a lot of calls, well, I didn't know I was supposed to sign up. Or they're on Social Security and they get their Medicare card in the mail and they go, well, what is this about? And why do I have to pay a monthly premium? It's a mandated law, you know, it's set up, our government set it up.
Okay.
We're under their, you know, so, but it's, other than the fact that they're taking out that money each month is the main thing. It costs, because that money goes to the provider or to the doctors.
And if you don't sign up, the money doesn't come out.
Right.
Which is why they penalize you.
Yes.
Oh, gee.
Yes.
Okay.
Yes.
That is crucial.
It is very.
And I guess I signed up.
I'm sure you did. I'm sure you did.
I guess I signed up. Well, when I turned 65, one of the things I did was, well, I signed up for Social Security as well.
And then you were automatically, yes, and you automatically got your Medicare card when you turned 65. Yes. And all the literature that came in the mail with it. Yes.
Okay. Okay, I was lucky. If you're going to do that, yeah, sign up for Social Security, and if you're going to delay Social Security, sign up for Medicare anyway.
Yes, absolutely, when you're 65. And of course, one more thing is our Social Security from Las Vegas comes here to Pahrump every month, the last Tuesday of every month, and they're over here at our Bob Rood Center. So if you have any question with Social Security, you can go over there and sign up. They usually show up from about 8:30 in the morning. Like I said, it's the last Tuesday of each month. If you have any questions, call me. I can give you more information about that.
Okay.
And or I can go with you if you have questions that you don't understand. The people that come here are very knowledgeable and very helpful. But we do not have a Social Security office here in Pahrump, unfortunately, so whatever information that they get, they take back to Las Vegas and process.
And if they have any questions on that, they would call your other number.
My 619 number,
619 number. And they can ask any question about Medicaid or Social Security.
Yes.
Okay.
I can also help you with our, like I said, with the Medicaid, or if I don't know, I'll find out for you.
And she's good about that. And like I said earlier, several people have come back to me to say how helpful she's been. So if you have questions, and I would have had some questions, but she's already answered mine. So if you have questions, be sure to call her. That's why she's here. She's volunteering to do all of these things. I could ask her how much she gets paid for all of this, but I know she likes volunteering.
I'm a volunteer only. I get no funds.
She really does this to help people. And like people ask me why I do this show, because I enjoy giving you the information that I feel you need. And that's why this show is so important. And the guests that come on are outstanding people. They're members of our community doing things for members of our community. So, Medicare, she's the counselor. She can provide you a lot of guidance and a lot of information. If you call her, she'll answer your questions. If it's with Social Security as well, like she said, if she doesn't have the answer, she'll find out. Mm-hmm. Okay. What else would you want to add on that?
If anyone needs any extra help paying for their prescriptions, because our prescriptions are really being way out there anymore, there is extra help for that, but it's income-based. So if you call me, I can tell you whether you're eligible or not.
Okay.
But there's several other options on getting your prescriptions by talking to your doctor to get a cheaper generic or some other program. But all you have to do is just give me a call, and I can let you know what we need to do.
Okay. Sandy, it just sounds like there's help for anybody and everybody that's out there.
You bet.
Now, if you're under 65, she can't help you.
No, unless you're disabled. If you're disabled, you're on Medicare or you're on Medicaid. So,
okay.
I mean, there is help for that, too. But if you are a healthy person and working and whatever, and you don't have insurance through, of course, the Medicare system, or you're through your employer, of course, we have our health link through the government insurance.
Okay.
And we'll see how that goes, too. But the insurance out there is very important, because a lot of us seniors, you never know what's going to happen. And the funds cannot be there if it's going to be a catastrophic amount at a hospital. And it makes me sad that some of our seniors cannot afford to get the health care that they need because they don't have the funds. So for one reason or another, either Medicare, Medicaid, the health insurance, or some kind of retirement of something, hopefully will help everyone stay healthy.
All of this information is here for you. Take the numbers that Sandy had on the screen, and whether we're talking about VetTrans, which we talked about the last session, or whether we're talking about Medicare, or whether we're talking about Social Security, be sure to give her a call and talk to her, ask questions, and pass this on to friends that may have some of those same questions. She's here, she's available. Sandy, anything you'd like to say in closing?
No, thank you very much. And if you do have questions, just give me a call.
Okay. One more time, be sure to call her. The numbers have been shown on the screen many times. Be sure to write that down. And we're going to see you again at our next show. Thank you.